Welcome to 5-Minute Birth Prep, where a certified OB-GYN doctor demystifies everything about the end of pregnancy and labor and delivery process. So today we're talking about Group Beta Strep, or GBS. We'll cover three things. 1, what is Group Beta Strep, or GBS? 2, when and why do we test for it? And 3, what is the treatment for it? 1, what is Group Beta Strep? So Group Beta Strep is a type of bacteria that's found in human bodies. We often hear about Group A strep, which is a cause of pharyngitis and strep throat. But Group B strep it's different, but it's related back in the bacterial world. Group B strep is found both in our intestines, in our vaginas, and around our rectum. So as you may know, our bodies contain millions of types of bacteria, and most of those bacteria cause really positive functions or neutral functions, and only rarely are actually bacteria harmful for us. We see those commonly, so we think, oh, bacteria bad, but many bacteria are good. So is Group Beta Strep bad or good? Well, it depends. So for a non-pregnant person, Group Beta Strep is just one of the normal bacteria that may be found in our vaginas or in our gastrointestinal system. It doesn't cause problems really for non-pregnant people at all, and we don't test for it. For a pregnant person, it can cause problems because compared to other types of the millions of types of bacteria that are present in our vagina and our bodies, this one uniquely can cause some problems at the end of pregnancy. 2, when and why do we test for it? Does everyone have Group Beta Strep? And the answer to that is complicated. Group Beta Strep can kind of come and go in some people. It can always be present in other people, or other people may not have it. It does have some variability in geography and race. So in a multicultural society like the United States, we would screen everyone. Group Beta Strep can be associated with infection of babies. So babies have a little bit of an immature immune system, and whereas a lot of the bacteria that's found in our vaginas and our guts are actually really good for the babies to develop their own microbiome, Group Beta Strep can actually make them really sick. So what we're worried about here is that Group Beta Strep can infect babies and cause something called early onset Group Beta Strep disease of the newborn. Early onset Group Beta Strep disease of the newborn typically presents in the first 12 to 48 hours of life and is different than late onset Group Beta Strep, which presents after 7 days of life. So we screen for Group Beta Strep because it can prevent the early onset Group Beta Strep disease in newborns. So how do we screen? Screening involves using a swab to test the pregnant person's vagina and around their rectum for the presence of Group Beta Strep. This is done at 36 weeks of pregnancy. If it's negative, there's nothing needed to do. But if it's positive, we recommend treatment. And why? Because treatment saves babies' lives. Here's the numbers. The process of using routine screening for Group Beta Strep and then treating women who may be positive has resulted in an 80% decrease in GBS, early onset disease of the newborn. The effects of Group Beta Strep early onset disease in the newborn used to be 1.8 per 1,000 live births before the onset of screening and treatment, and afterwards it was reduced to 0.23 per 1,000 live births. So really it prevents a lot of illness and suffering in the part of newborns. Part 3, GBS treatment. Okay, perfectionist alert. I realized as I was recording this that I had said part 3 is what is the treatment, but actually treatment isn't the goal here because like I said before, it's not really an infection, it's just a colonization. So the actual term is what is the prophylaxis for early onset Group Beta Strep disease of the newborn. And the prophylaxis for that outcome is IV antibiotics while a positive woman is in labor. So those antibiotics are penicillin and ampicillin, depending on what your hospital has on formulary. They're very closely related, and they're only given during the labor process. Now, I know I talked about testing for Group Beta Strep between 36 and 37 weeks, but there may be another reason that your doctor gives you penicillin or ampicillin for prophylaxis, and that is a part of one of the other P's. If your labor is preterm, if you have a fever, if you've had a urine culture with Group Beta Strep, at the beginning of pregnancy early on, or if your water has been ruptured for over 18 hours or you have a fever. So there are some other reasons that we prophylax for group beta strep disease of the newborn. Okay, back to my final note. Sometimes I hear some concerns about group beta strep, and I just want to address them real quick before we end the video. One is that group beta strep means you have an infection or it's something negative. It's only negative because in a public health perspective, we can help decrease harm to babies if we give moms antibiotics during labor. But it doesn't mean that you did something wrong, and therefore also, because it's a normal part of our bodies that kind of can come and go, it's not something that you can do something to prevent or treat on your own. I have heard things on the internet like, oh, putting like garlic in my vagina will get rid of GBS. Please don't do that. Please don't put garlic in your vagina. One, it won't help you get rid of GBS. Two, like it just doesn't belong there. And then another thing I've seen is some concerns about the fetal microbiome effect of having antibiotics when you're in labor. So I think that there's an interesting way to address this. One is that, like I mentioned, this is a very short course of a small strength antibiotic, so it's unlikely to have that effect. But I will say there isn't really data comparing babies who have been exposed or not exposed to the antibiotics in labor, but we do have data showing major benefits to babies who can get really sick from early onset GBS, disease of the newborn. Additionally, our microbiomes are very complex, so I wouldn't focus concern on that at all as a doctor. It would be interesting to see data going forward if there are some differences. I would suspect there probably isn't because it's a very, like I said, short amount of time and a short antibiotic. I'm so glad you joined me today, and stay tuned for more episodes, and don't forget to check out my other episodes, and please subscribe to learn more about birth.